gotten a number of questions this week from viewers and patients and people that have texted me. One stands out, and he says, so how do I know if I have low testosterone? I think that's a good question, because I think there's a lot of people out there with the same question. If people didn't have that question, you wouldn't see all those ads on TV for all of the supplements to take. And so this guy kind of wants to know, how do I know if I have it? You know, there's a number of symptoms and signs that guys will have when they have testosterone. Studies show that about 40 to 45% of all men over 45 will have low testosterone. At 50, it goes up to about 50%. 60 years of age, about 60%. So it just continues to climb as you get older. So what are the signs and symptoms? So gaining weight. Have you been gaining weight around the midsection over the last 4 or 5 years? Hard to take off. Have you been trying different diets and it hasn't worked? Have you had lower energy? Come home from work and you just want to hit your chair or get onto the couch and just stay there for the rest of the night. Different things that you used to enjoy doing, you really don't want to spend the time or the energy to do it. And so there's a number of cases of patients I've seen that have come in with just those exact symptoms. Guys will get a little bit older and they'll say, you know, I don't feel as though I'm making as many gains in the gym anymore. I just kind of hit a wall. I feel weaker. I just don't feel like I've got that pep in my step anymore. They've gained their weight. They've noticed that at the gym they've kind of lost some muscle. They used to be able to bench a certain weight. Now they're not benching that much at all. And so I think overall, the number one question as a general rule of thumb to determine whether or not you have low testosterone or the symptoms of it is, number one, do you have, in the course of 7-day week, how many days do you wake up with a morning erection? If it's less than 4, you probably have low T or signs of low testosterone. You go to a doctor, you get your panel tested to see where your levels are at. Many doctors don't treat low T, and so they'll say you're normal, you're in the normal range, but yet you're not feeling so good. You feel weaker, you feel lackluster, you feel like you don't have that sparkle that you kind of used to have, your charisma, that type of thing. And I think one of the things that when you're out there with lower energy and you're having all of these things, whether you go to the gym or maybe you weekend warrior it, and you notice it just takes you longer and longer to recover from your activities. And look at your sleep. Has your sleep been disturbed? Are you still sleeping as good as you used to? Have you lost that pep in your step? How's your mental acuity? Are you still as sharp on your job than you used to be? Are you able to go as fast with your job and get things done in that quick manner that you used to? Do you find that you have memory lapses? That your memory isn't as good as what it used to be? All of these signs and symptoms of getting older, yes, they follow a normal course. However, there's something you can do about it. Have you looked at where you used to have maybe different visions and different dreams of things that you wanted to do, and you kind of put them by the wayside? Those are all signs and symptoms of low testosterone. The interesting thing, when you do go to a doctor, many of them will kind of dismiss you a little bit and say, nah, your levels are good. But the interesting thing, women have a tendency to kind of be a little bit more forward with physicians and with doctors. And so what I tell people is, be a little bit more aggressive with your doctor in terms of getting your testosterone levels checked and also treated. So when you ask the question, how do I know if I have low T? We just went through a whole number of listing. If you find yourself having those symptoms, check us out on the webpage, armurmedical.com. If you are not in the area where I'm at, send me a text, send me an email, and and we'll hook you up with some provider where you can get your hormones optimized.